to be your student nurse today. So if I can, just identify you by name and date of birth. Okay, good deal, Miss Smith. So today we have doctor's orders to do a wet to dry wound care dressing and then a dry dressing. So before I do that, I'm just going to go ahead and check your allergies. Okay, so there are none, so we're good there. So now, before I do the wet to dry, I'm just going to show how I would clean the area and take off the old bandages. Okay, so first I would perform hand hygiene, and then I would put on regular gloves. Okay, so then I just take the old wound, and from the closest end towards me, I would pull so that my patient cannot see. So it's not in my patient's view, but it's in my view. And then once the bandage is off, I assess the wound. So I'm looking at the skin texture, the skin color. I'm also looking for drainage, and I'm removing any eschar that's there. And then I'm going to do the length, the width, and the diameter. I'm going to do all of those measurements and document those from the widest and the most length and the deepest down. So once that's done, I'm going to go ahead and get saline and just clean the area real good. And so that's where we're starting off now with the wet to dry dressing. So first, wet to dry dressings, those call for a sterile field. So I would first come in and do proper hand hygiene. And once proper hand hygiene is done, my sterile field was already maintained beforehand. I wouldn't do this in a regular setting, but I am in this setting. So now I'm just putting on my sterile gloves, not turning my back. And now that my sterile gloves are on, I can just maneuver them. Okay, so now that that's done, I can go ahead and get started maintaining the sterile field. So I'm going to get my tongs, and I'm just going to get a piece of gauze, and I'm going to put it into my sterile saline, and I'm going to let it soak. Okay, and then next, I just need to make sure that my sterile field does not get any water on it, or it will not be sterile anymore. So I'm going to pull up my gauze, and I'm going to wring it out. This is really just, we want damp, but we do not want wringing wet gauze. So now that is wrung out, I'm going to go ahead and I'm going to pack it, and I'm going to de-ravel it, and I'm going to make sure that it doesn't really touch the outer parts of the skin. Okay? So now that that is compacted, I'm going to go ahead and I'm going to do one more. Okay? And let that soak. And once it's soaked, I'm just going to do the same thing. Just wringing it out. Because like I said before, we want damp. Okay. Now I'm just undoing it. Okay. And I'm trying to keep it from touching the outer part of the skin. Okay, so now that that is done, I'm going to go ahead and get a dry piece of gauze and put that over the area. And now that that's done, I'm going to go ahead and I'm going to get my ABG bag, which was sterile. I'm going to pretend that I opened it up, and I'm just going to tape it, and I'm taping it mostly on the ABG pad and not the skin, because that creates skin irritation. Okay, and my orange just isn't quite long enough, and the tape isn't sticking, but that's because this isn't an actual patient in a real healthcare setting. Okay, so now that all 4 of my corners are taped, with my last piece of tape, I would just go ahead and I would write my name and student nurse, SN, the time and the date of the wound dressing. Okay, so now that that's done, I'm just going to go ahead and remove the ABG pad so that I can use it for my dry dressing. So with the dry dressing is basically the same as the wet, except we're not using any solution, it's just dry. And it would be the same in regards of I would assess the skin, clean the area, all that good stuff, okay? So now, this is my new patient. She's been identified just like the other. And I would just put on first, I would change my gloves. And this procedure does not need sterile gloves, so I would just do regular hand hygiene. And then I would put on regular gloves since we're dealing with a new patient, new wound. So now I would just put on 1 sterile gauze, dry, and then I would put on the ABG pad. The same thing with the skin irritation. And then once all 4 sides are neatly done, I would go ahead and place my tape on it that said my name and student nurse, the date and the time. Okay, and that is wound care.